I never wanted to become, my father is a physician in small town Arkansas, and I never wanted to do what he does at all. I took a job at a hospital, and on the first or second day, I found myself in an operating room seeing an operation, and it was an epiphany. It was a moment, the moment that changed my life completely, changed my career path. There's just something about being in the operating room and doing what it is that we do, and it's a little bit of a visceral sensation. It's abstract. It's tough to actually put words to, but almost all of us have it. The majority of my patients are cancer patients. Most of them are lung cancer patients. You can get other types of cancer into the lungs, but the vast majority of people that I care for are lung cancer patients. And lung cancer is a terrible disease. It's a little bit of almost a hidden fact, but the mortality of lung cancer yearly exceeds the mortality of breast cancer, colon cancer, prostate cancer, all combined. And people hear that and they're like, "What?" I had no idea, because there's not any lung cancer ribbons out there. One of the first things that I communicate to people is that they're lucky, in a sense, because most of the people that get the diagnosis have no chance to have the tumor surgically removed, and therefore their chance of being a survivor, being a cure, is much, much less. Another shock to people is that understanding that the mortality and the morbidity of lung cancer surgery is 2 or 3 times higher than heart surgery is. You have to be extremely meticulous about how you care for these people, and it involves not just the surgeon with the right ideas. It involves the anesthesia personnel, the nursing staff, the respiratory staff in the hospital, the physical therapist in the hospital. It takes a committed hospital team to optimize the care for these patients, and that's what we are establishing here. One of the interesting changes, I think, in probably healthcare in general, but certainly in cancer care, is that we're really going to a multidisciplinary approach. And I think that it's very tough to organize at the community level, and Blake, I think, has done a fantastic job of having a lot of this in place. It's interesting, we have several people that I work with, and we communicate via our new media technology, if not daily, certainly every other day. I'll have my radiation oncology colleagues or my medical oncology colleagues send me a picture on the iPhone of a mass. What do you think? And I'll send a picture back of a mass saying, "Can you be involved in this person's care?" And so we have sort of an ongoing multidisciplinary clinic, via our new audio-visual techniques. It's really exciting, and I think it's the best way to take care of people with lung cancer. The greatest satisfaction that I get in my job is having someone come into my office after 2 or 3 years as a survivor. I'd like to see the look on their face that is so completely different from the look on the face that I saw the day that I first met them. It's pretty powerful, because we are fighting a terrible disease, and a disease that wins most of the time.